When it comes to Medicare supplement insurance versus Medicare Advantage plans, there are some key differences and things that you really want to consider before you make your Medicare decision. So in today's video, I'm going to explain exactly how these plans differ. I'm going to go over cost comparisons that you can expect to pay on each of these different plan options, and I'll help you determine which type of coverage would be best for your needs. And finally, I'm going to give you some tips and really important information on some of the limitations that you may face if you want to switch back and forth between these types of plans in the future. So a really important video for anyone who is already on Medicare or about to get onto Medicare for the first time. Stay tuned. Hi, my name is Stephanie Abt. If you are new to this channel, I am a licensed independent insurance professional, and I create these Medicare videos so that we can educate seniors all across the country on Medicare so that you can make an educated decision when it comes to your Medicare needs. If you find value in today's video, please go ahead and like the video. You can share it with someone who may find it useful. Subscribe to the channel to see more content like this, and leave all of your questions and comments for me below. All of those things help videos like these get seen by more people who can really use this information. So everyone who's on Medicare, everyone who's enrolled in traditional Medicare Parts A and B is going to essentially have two main ways that they can choose to get their coverage. So I like to explain it as kind of like a fork in the road. You've got to choose which path you're going to go down when you're on Medicare. So when you're enrolled in traditional Medicare Parts A and B, that's your hospital and your medical insurance coverage that you get through the federal government, either when you're 65 and over, or certain people under 65 with disabilities are eligible for Medicare. Medicare Part A is premium free for most people, as long as you've been living and working in the United States for about 10 years or 40 quarters. Medicare Part B has a monthly premium. In 2024, that premium is $174.70 per month, although it may be higher if you are a high income earner. So everyone that's on Medicare is typically going to have to pay that Medicare Part B premium no matter which path you choose. Now, the first option, the first path, is to keep your traditional Medicare benefits through the federal government, your Parts A and B coverage. By doing this, you are allowing yourself the freedom to use any Medicare doctor anywhere in the country. So traditional Medicare has no networks. As long as the doctor takes Medicare, it doesn't matter where you are in the US, you can use your Medicare benefits. Now, Medicare Parts A and B is your medical and your hospital coverage. So if you want or need prescription drug coverage, then you'll typically need to add on a separate standalone Medicare Part D prescription drug plan. Now, Part D drug plans this year start as low as 50 cents a month in many states, $0 a month in some states, and they can go up from there depending on the type of prescription drug plan you choose. And finally, most people on traditional Medicare will want to add on some type of supplemental coverage. So traditional Medicare in and of itself doesn't cover everything at 100%. Medicare pays about 80% of your medical services, and you're responsible for the other 20%. And there's no cap on how much you would be responsible to pay out of pocket with that 20%. So many people will want to add on a Medicare supplement, also known as a medigap plan, to supplement their traditional Medicare benefits and pay that 20% that traditional Medicare doesn't pay. Now, the great thing about Medicare supplement plans is because they cover that 20% that Medicare doesn't pay, you typically have very comprehensive coverage if you choose to go this route. That means that if you go to the doctor, you go to the hospital, God forbid you have a chronic condition, cancer, etc., you're going to be left with little to no medical bills if you have traditional Medicare and a good Medicare supplement plan. Additionally, because you're on traditional Medicare, you have the freedom to choose your own doctors. There's no networks, you don't need referrals to see a specialist. Now, the downside is that these Medicare supplement plans have a separate monthly premium. So on top of the $174 you're paying every month to be on Medicare Part B, you have to pay an additional monthly premium for that Medicare supplement plan. And in many parts of the country, that'll be another $100 to $150 a month or more. Depends on your age, where you live, and a few other factors. Additionally, Medicare supplement plans only cover what Medicare Parts A and B cover. So Medicare supplement plans typically don't include any extra benefits like dental or vision services. Things that are not covered by traditional Medicare are typically not included in a Medicare supplement plan either. Now, the other option, the other path that you can choose is to do a Medicare Advantage plan, also known as Part C of Medicare. When you think of Medicare Advantage, you want to think of it as an alternative way of receiving your Medicare benefits. So while you're still enrolled in Medicare Parts A and B, if you have a Medicare Advantage plan, you're choosing to enroll in a managed care plan, like an HMO or a PPO plan. So now when you go to the doctor and hospital, you're not showing them your red, white, and blue Medicare card anymore. You're showing them your Medicare Advantage card, whether that's with Humana, Aetna, etc., whichever insurance company you choose for your Medicare Advantage plan. Now, in most parts of the country, Medicare Advantage plans are $0 a month. And most of the time, they include your Part D prescription drug plan benefits rolled right into the plan. So sometimes you'll hear these referred to as all-in-one Medicare plans. So the good thing about Medicare Advantage plans is that you are getting a very low monthly premium. Like I said, typically as low as $0 a month in most parts of the country. And you can also get extra benefits on the plan that are not included in traditional Medicare. So oftentimes you'll see these plans include things like dental or vision benefits. Maybe they include a free gym membership benefit, over-the-counter benefits. These are some things that you will see included on some Medicare Advantage plans that are typically not covered on traditional Medicare. However, you do want to be aware of some of the limitations that can come along with Medicare Advantage plans. For example, like I said before, these plans are managed care plans. Like HMO or PPO plans, you're working with a network of doctors. That network can change really anytime throughout the year. You may or may not have coverage out of the network, and you may or may not need a referral from a primary care physician to see a specialist. On a Medicare Advantage plan, you are paying $0 a month for your monthly premium usually. However, most plans do have co-pays, deductibles, and co-insurance that you will be responsible for when you go to the doctor and hospital. For example, many Medicare Advantage plans have co-pays where you're maybe paying a few $100s a day for the first few days of a hospital stay, or you're responsible to pay 20% co-insurance for things like chemotherapy or durable medical equipment up until you've met that plan's out-of-pocket maximum for the year. Finally, data has shown that prior authorization is much more prevalent on Medicare Advantage plans as compared to traditional Medicare. Now, there are pros and cons to both of these options. Now, when we're talking about an overall cost comparison for Medicare Supplement versus Medicare Advantage, I wanted to break that down with some numbers for you that I'm going to show you right here on my whiteboard. Medicare Part A, we know, has a $0 monthly premium for most people. Medicare Part B, monthly premium is $174.70 a month for most people. Again, could be higher if you're a high-income earner. Medicare Part D prescription drug coverage can vary. I plugged in $20 a month as a low to medium average monthly premium for 2024. Medicare Supplement Plan G is one of the most popular and comprehensive Medicare supplement plans. In many parts of the country, this will be about $130 a month for someone who is turning 65. So your estimated monthly total here is about $324.70 a month. Again, these are just estimations. And your annual deductible on Medicare Supplement Plan G for any hospital medical services at all is going to be $240 a year. That's the most that you'll pay out of pocket for any Medicare covered medical service. So when we add this all together, you're looking at a total annual output of about $4,136 per year. And this is kind of your all-in number on traditional Medicare with a Medicare supplement plan using these estimations. Now let's compare that to Medicare Advantage. So if you decide to go with a Medicare Advantage plan or Medicare Part C, most Part C Medicare Advantage plans are $0 per month. So for most people, you're going to pay an estimated total of your $174.70 per month if you're enrolled in a Medicare Advantage plan. Now, the big kind of question mark here is, what is your actual annual spending going to be? Now, on a Medicare Advantage plan, you're going to have set co-pays and co-insurance amounts that you pay if and when you go to the doctor and hospital. Now, let's say you're healthy as a horse and you never go to the doctor, or you just go get one annual preventative visit every year. In this case, you'll definitely save money by going with a Medicare Advantage plan, because using these estimated numbers, if I'm only paying my Part B premium, then I'm only paying about $2,096 per year versus the over $4,000 that I was looking at on the Medicare supplement insurance. However, Medicare Advantage plans can have maximum out-of-pocket limits of up to $8,850 a year. And while many people will never reach that maximum out-of-pocket limit, if you do get diagnosed with something like cancer, or if you have one or more hospital stays, these types of things could help you creep up closer to that maximum out-of-pocket limit. Now, in Medicare Advantage plans, the out-of-pocket limits can vary. Some Medicare Advantage plans will have quite low maximum out-of-pocket limits of $1,000 to $3,000 a year, whereas other Medicare Advantage plans, they can be, again, up to about $8,800 a year. So this is where you really need to examine the Medicare Advantage plan's benefits to understand exactly what you're getting into. Additionally, Medicare Advantage plan benefits can and do change every year. So just because a plan has a certain maximum out-of-pocket limit this year does not mean that that will not change in the future. So if I was on a Medicare Advantage plan with a high maximum out-of-pocket limit and I got cancer, something serious happened, and I had to meet that maximum out-of-pocket, now I'm looking at a total of about $10,946 per year. So in that situation, right, I'd be spending a lot more out of pocket than I would have if I had the Medicare supplement plan. So this is really the big question, and it's going to be very dependent on the plan that you choose and how you're using your coverage. So with this information, many people will think, well, why don't I just sign up for a Medicare Advantage plan while I'm younger and healthier, and then switch on over to a Medicare supplement plan when I'm sicker, when I need more complete coverage? And unfortunately, it is typically not that simple. Now, there are a few states, the ones you see listed here, in which you really can switch every year if you wanted to, back and forth between Medicare Advantage and Medicare Supplement. These states have special guaranteed issue rules in which something called medical underwriting doesn't apply. However, in most parts of the country, Medicare Supplement plans are going to be subject to medical underwriting. That means that the insurance company can ask you a list of health questions. They're going to look back at your health history, your medications, and they determine whether or not you qualify for their coverage. Now, when you're brand new to Medicare, you never have to answer any health questions for Medicare supplement insurance. All of these plans give you a one-time open enrollment window that is triggered by your Medicare Part B effective date. But when that window closes, if you want to get a Medicare supplement plan, then you typically have to pass through medical underwriting to qualify. So if you start off with a Medicare Advantage plan and then down the road you want to get a Medicare supplement plan, in most states, you will have to pass through medical underwriting to qualify. So if you have a major health condition, or you have a pending surgery or a treatment, you may not be able to make that switch. Now, Medicare Advantage plans don't have any medical underwriting. So if you are on a Medicare supplement plan and you want to switch to a Medicare Advantage plan later on down the road, then typically you can do that every year during the fall open enrollment period. Now, there are some exceptions to this rule. There are things called trial right situations, which I've linked a video below that talks a little bit more about that, as well as other situations that may grant you guaranteed issue rights to purchase a Medicare supplement plan without that medical underwriting. But that's one thing that's really important for folks to know when it comes to switching back and forth between these different types of coverages. My best advice for you would be to not get bamboozled by all of those Medicare commercials that you are seeing that are promising you all these free benefits that you're entitled to. Those commercials, those advertisements are trying to get you to call into their big call centers so that they can sell you a Medicare Advantage plan. And a lot of the times they will sell you a plan without fully explaining to you how that plan works. So by watching this video, you are one step ahead. You're getting knowledge about how Medicare Advantage plans work, how Medicare supplement plans work, so that you can make an educated decision. Now, here in my office, we work with both Medicare supplement and Medicare Advantage plans. We're very knowledgeable about all of the different plan offerings in all different parts of the country. We are licensed in 46 states. My agents and I are independent brokers, so we represent over 30 different insurance companies. And if you call into our office, we offer free, unbiased service and support. We do a very individualized needs analysis for you so that we can determine based on your health, your budget, your specific situation, which type of coverage is going to be best for your needs. Please feel free to call or email us anytime. We would be more than happy to help. Thanks again for watching, and we'll see you soon.